Hello everyone, this is Dr. J back again with the Human Movement Institute, where we have improvement through movement. Staying upstairs in the cervical spine, we are going to spend more time in teaching our bodies and ourselves how to glide and slide the nerves that come off of the neck, called cervical nerve roots, and how they end in certain nerves. Today will be median nerve bias, and we actually have a decent amount of evidence and research that you can bias different nerves depending on the position of the shoulder, shoulder blade, arm, elbow, and hand. But to focus more higher up or more proximally, closer to the neck, anybody with C5, 6, or 7 nerve root impingement in the neck can bias the median nerve and glide this, thereby getting relief of symptoms that's radiating down the arm, which is known as a cervical radiculopathy. To bias median nerve, you put the palms up. If I drop the shoulder blade down, I can feel a sensation radiate down my arm like numbness and tingling clear down to my hand. That's median nerve bias off the thumb, index, and middle finger. By doing this position, I can take tension out of the nervous system by elevating the shoulder blade, tilting towards it, and then reversing it to glide or floss the nerves of the neck, median nerve bias. Self-nerve glide. These are to be done not forcefully. I'm not trying to stretch it. I'm trying to floss and glide the nerve. See our previous video, Egyptian dancer nerve glide, to see the subtleness of the head and neck movement as we glide these nerves from our neck down the extremity. An initial starting dose is 20 repetitions, 2 to 3 sets, 2 to 3 times a day. How do you know if this is improving your symptoms? Well, number one, you need an accurate human movement diagnosis. We need to diagnose that there's a median nerve bias neural mobility issue, particularly starting in the cervical spine. This then allows us to prescribe the right movement in the appropriate starting dose and have proximal control of the nerves in the neck with certain hand or arm positioning. More acute cases, we need to take tension out of the nerve, but as time goes on, we want to start to add full neural mobility with full range of motion. So I can take tension out by shrugging and tilting towards, and I can put tension in the system by tilting or side bending away. And you can sense this in your own hand by tensing away, extending elbow and wrist, more tension, more sensation into the hand, or I can shrug the shoulder, gently side glide or side bend to the involved side to have less tension. We don't at this time know what best way to start. Do I go towards versus away the side of pain? But we are seeing some promising evidence come forth in cervical radiculopathy literature, where if we start to glide and slide these neural structures and floss them on the path in which the nerves live, we can drastically reduce the radiating symptom. Not to mention, nerves are bloodthirsty and love movement. When they get compressed, they hurt really bad, like lightning bolt shooting pains. They can also cause pins and needles and even numbness and tingling to the point of totally going numb. This means the nerve's compressed and is in need of some serious love, which is from the human movement system. This concludes our video on patient-controlled median nerve bias proximal control video. If you liked it, please hit the like button, the subscribe button, and share this median nerve bias cervical gliding video with your friends and family. Take care, and I'll talk to you all again soon.